again for PACE Concussion. This week I'd like to talk to you about an article from McGill University published in the Clinical Journal of Sports Medicine. It looked at athletes' awareness of concussion and how they dealt with it. This study looked at CFL football players, and 80% of them, although suspecting or recognized as having a concussion, didn't deal with it properly. I'm not sure that this translates directly to amateur athletes. Amateur athletes still make the same mistake. They continue to play in spite of suspecting a concussion for personal reasons. There may be peer pressure, coach pressure, parent pressure, scout pressure. The suspected concussion getting in the way of an immediate goal. This is a dangerous behavior. If you have a concussion on top of an unresolved concussion, you run the risk of developing what's called second impact syndrome. Second impact syndrome is a disastrous neurological complication where 50% of those who have it die, and the remaining 50% are left with serious neurological impairment. We want to avoid that at all costs. It's not something we ever want to deal with. By properly recognizing, dealing with your suspected concussion, once you recognize the symptoms are suspected, removing yourself from play and recovering and not returning until you're fully recovered, you can avoid this disastrous possibility of second impact syndrome. So if you suspect you have a concussion, seek help. Go see a medical professional. Take care of yourself. Return to play safely. Take care. Talk to you next week.